My name is my name is Dr. William Kemp. I'm a spine neurosurgeon at the Virginia Spine Institute. I've
Mhm.
been with VSI since August of 2022. Um, I'm the only neurosurgeon at this practice, and I have the pleasure of working with uh, orthopedic spine trained spine surgeons, in addition to other practitioners in the fields of neurology, physical medicine, rehabilitation,
Mhm.
uh, and pain management. Period. It's been an absolute pleasure, an honor, and privilege taking care of the great people of Northern Virginia and beyond. I'm looking forward to what the future has to bring.
Yeah, awesome. That's great to hear. So, Dr. Kemp, if you don't mind elaborating a little bit about your practice, what type of referrals do you see when it comes to spinal patients? A little more clarity for our listeners as to when they should go see a neurosurgeon versus a general orthopedic or something like that.
Yeah. So I think that's a really good question. I think for one, first of all, uh, whenever a patient has back pain or leg pain or arm pain or neck pain, uh,
Mm-hmm.
patients will often feel fear at the thought of having to go see somebody for possible surgery. The
Sure.
reality is, taking care of people, I really do view it as an opportunity to take care of people without surgery as often as I possibly can. Only 10% of the patients that we see on a regular basis are patients that have failed conservative management, non-operative management, and we
Mm-hmm.
see surgery as the next best step. Uh, we do think that there are often lower hanging fruit options, whether it's with injections, physical therapy, oral medications, change of lifestyle, that can often get patients what they want in terms of returns to activities and also relief of symptoms.
Mm-hmm.
I do think that in certain populations, particularly patients that are in their 60s, 70s, 80s, surgery, may not be the best option oftentimes.
Right.
And when
Mm-hmm.
I come and when they come and see me, we really go through a customized plan so that we can
Mm-hmm.
get patients back to their lives without having to put them through the risks of a large surgery. Uh,
Sure.
However, there are times when surgery is actually the conservative option. But I
Mm-hmm.
really, in all my patients, this is coming from a surgeon, I want to take
Mm-hmm.
care of people the best that I can. If we can take care of them without surgery, we really try to do that.
Yeah, no, that's so great to hear, especially from you, like you said, coming from a surgeon. So it breaks the myth, among the people, and they can feel more at ease just getting a consultation or seeing what's best for them. So in general, when you see a patient with a back issue, a leg pain, arm pain, neck pain, like you said, as very broad criteria, when would you say a person is a candidate for a surgery versus when would you try the other treatment options that you just mentioned?
Right. I really try. I really try whenever we see a patient. It really comes down to listening to the
Mhm.
patient, seeing what their symptoms are, and also laying hands on them, performing a thorough neurological and physical examination to really pinpoint specifically what the problem is. Back
Mhm.
pain can mean so many different things to so many people, and it really comes, down to the provider in my team to really glean out what specifically is the patient telling us in terms of their symptoms. How long have they had it? Which activities make the pain better versus worse? What have they tried already in terms of
Mhm.
symptom alleviation? By performing an examination of somebody and listening to them very closely, we often are able to, very clearly see what the next best step is. And oftentimes it can be an injection. If we do an injection on somebody and we're able to knock out the pain they have entirely, it's like, well, let's talk about the next best step. Should we just,
Mhm.
continue doing the conservative management, or should we be considering surgical options? And it really comes down to a conversation with the patient in terms of making sure they're fully informed in terms of the risks and benefits of waiting and
Mhm.
also continuing on the current course of non-operative treatment. At the end of the day, we're taking care of people. We're not trying to treat images. We're trying to take care of human beings and trying to meet their needs to get them back to the lives that they love.
Right. Yeah, no, I love it. I love the fact that you talk about the customizing of the programs versus the one size fits all approach. I think the patients these days, that's what they really want and they need. So, in general, what would be your like general tips and advice for someone who's 50 plus, who's starting to have a little bit of degeneration in their spine, but they would like to stay active, they would like to keep their spinal health optimal? What would be some of your general tips for our listeners?
I think, when somebody has an aging, degenerating spine, it
Mm-hmm.
really comes down to, trying to understand what is degenerating. And whenever somebody has a shoulder or a hip that's going bad or degenerating, if you will, it really is relatively pinpoint in terms of where the problem is. You have a hip issue, you have hip dysfunction, you have a shoulder dysfunction, and the question there is, how can we, whether it's consideration for a shoulder replacement or a hip replacement, there are options there from that standpoint. But when it comes to the
Sure.
spine, every single level has three joints: the disc in the front and the two facet joints in the back, not to mention all of the soft tissue that can be causing inflammatory symptoms as well. When I
Mm-hmm.
see somebody that has pain at a specific spot, there are different things we can do depending on where that pain is coming from.
Right.
If somebody is having a first time pain issue, or even coming in they're just looking for good advice, that as they're heading into their 50s, 60s, 70s, they want to know, hey, how can I prevent me ending up in the operating room with somebody like you? And what I'll tell them is, well, you know, if your spine is degenerating, it's a good likelihood that your discs are also degenerating. The discs are meant to support, the intervertebral discs are meant to support everything north of it, okay?
Mm-hmm.
And when that happens, when that support tends to decrease over time, if that were to happen, we have to figure out ways to bolster your spine through other means. And that comes with building up your core muscle strength, doing the physical therapy. The reality is we should all be doing physical therapy.
Mm-hmm.
It doesn't matter if you have symptoms or not. You should be doing some form of physical therapy, exercise, weight control, eating right, not smoking, because doing all these things in the right direction allows us to preserve or at least delay the natural aging process. We certainly don't want to accelerate it. There are definitely ways of accelerating the aging process and the degeneration of one's spine. My job is not only to take care of patients from a surgical standpoint if needed, but really from a total comprehensive spine health standpoint. How can we take care of somebody so they can avoid seeing somebody like me down the road? And the best bet is good physical therapy, good core muscle strengthening exercises, stay away from the smoking, stay away from the alcohol, eat well, keep moving.
Mm-hmm. Yeah. Love it. No, I love it. I love how you summarized it. It's the whole package that they need to be a part of, the lifestyle changes, keep moving, avoiding the smoking and alcohol, physical therapy, and things like that. I'm sure people who are heading 50 plus would love to take that advice and start to implement it into practice and prevent things before they start to get worse. Anything else you would like to add for our listeners? How can people reach out to you if they need a consultation from a
Sure.
neurosurgeon?
What I think one thing you asked before that I didn't respond to was, what's the difference between an orthopedic spine surgeon and a
Yeah.
neurosurgeon that does spine surgery? Well, for when I did my training at the Cleveland Clinic in neurosurgery, brain and spine, I was trained to do brain surgery, but my passion and my skill set is really catered towards spine surgery, okay,
Mm-hmm.
and taking care of patients with spine problems. Spine problems can range everything from adult scoliosis, degenerative scoliosis, all the way to the adolescent arena as well, and everything in
Mm-hmm.
between. That would include uh, spinal cord stimulators, tumors, um, and frankly, any condition related to the spine. Uh, the difference between an orthopedic spine surgeon and a neurosurgeon really comes down to training in terms of the things that I am trained to do. If somebody were to have intradural pathology, whether it's a tumor or a cyst within the spinal cord, that would be something that I'm trained to treat. Okay.
Right.
Other than that, my partners and I do for the vast majority, probably for 95% of the cases, we're doing pretty much the same type of treatments. Okay.
Right.
When we see patients, we try to meet them where they are. If they were to request me, we'll get them in as soon as we can. I think what I bring to the table is a very comprehensive background and understanding in spine pathology. Not to mention that we really try to take care of patients without surgery. That's the number one goal. Get patients back to what they love doing in a safe, healthy, and effective manner.
Love it. Love it. No, I love that clarification, like you said, because a lot of times people don't understand which provider they need to see. So it helps to kind of break that down and help calm their anxiety or intimidation in even seeing a neurosurgeon. If they are advised to see one, there will be less hesitation to see one.
Sure.
Anything else you would like to add for our listeners and the best way they can get in touch with you?
I think the best way to get in touch with me is to check us out at vsi.spinemd.com. We have a multidisciplinary practice that has been rooted in the Northern Virginia area for the last 32 years. We provide excellent comprehensive spine care, and we were able to take care of our patients, like over 90% of our patients without surgery. I think we have a great practice, and I look forward to taking care of people as the years progress.
That's great. That's great. It was so nice chatting with you, Dr. Kemp. Thanks for taking the time to be on our show.